By the way, I do enjoy your Twitter handle.
I'm looking forward to being unleashed again.
Hang on 1 second here. Give people a second to find it. Come on in, everybody. Share the link if you would. Okay. It didn't tag you. I forgot to add your Twitter handle, but that's all right. All right. Come on in, everybody. Welcome back to The Holler. I'm Justin, founder of The Holler. Been gone a little while, but we're back now with a very special interview here on The Holler. Before we get into this with Dr. Fiscus, I want everybody to know that we are all across the state. We have hollers everywhere, and that's all thanks to the generosity of our readership. tnholler.com is where you can find us. Your small dollar donations are what keep us going, and make it $10 a month or more and get one of these sweet hats that I'm wearing. Dr. Fiscus, thank you for joining us today. Obviously, you are here in between hits on Chris Hayes. I think you're on Maddow tonight. You've been on CNN. Obviously, this has been big news, what's going on with you. So I appreciate you taking the time to be here on The Holler.
Thanks, Justin. Thanks for the opportunity to talk with you.
Absolutely. Feel free to comment along, everybody, if you have any questions. Obviously, we're live right now. The first question I have for you, Dr. Fiscus, is how are you doing? It's been a whirlwind. I don't think you expected it to be like this. How are you?
I'm good. No, I didn't expect it to be like this. If you'd asked me, Monday, what I thought I'd be doing Tuesday, I thought I was going swimsuit shopping with my daughter on my first day off. So this has been a whirlwind, to say the least, and the response has been remarkable. A friend of Brad's messaged him from Paris, France this morning that the story was airing there. So that's not where I expected to be, but I'm good. The support that I've had from my colleagues in pediatrics, the American Academy of Pediatrics at the Tennessee chapter of the AAP, at former patients that have reached out, and my TDH colleagues from all across the state, has just been amazing, and really that's what's given me the lift to be able to keep talking today.
Well, I know plenty of people that I've heard from here in Tennessee, voters, and even people that work in various health departments across the state appreciate the work that you did. They enjoyed working with you. They said you were one of the reasonable voices inside the department, and appreciate also that you're speaking out, which I know probably couldn't have been an easy decision. What I was hoping to do is just kind of walk through what happened here. I know you've done that a little bit on some of these other shows, but I think it's gone a little quickly. So I just wanted to do it sort of a little bit slower. My understanding, and then you can sort of help me through it, reading your statement, was basically that you were getting questions about how physicians and people that were giving the vaccine were supposed to handle minors. And from your statement, which I'm just going to read, you said you reached out to the Tennessee Department of Health's general counsel to request a statement regarding the mature minor doctrine from a Supreme Court ruling, Tennessee Supreme Court ruling. You got a document saying, here's the new summary of the doctrine posted to the website and blessed by the governor's office. Feel free to distribute to anyone. Did you think you could distribute that to anyone?
When you get a message from legal counsel, you can usually take it for what it says, and they're often more cautious about releasing information than probably anybody else in the department. So yes, I took it as face value. I had prefaced that in the email to the general counsel about what it was for. Hey, I'm getting questions from physicians and health departments about what to do with minors. Can you share with me, the information that I can share? And so I did that. I did write a short preamble that came before it, about, just, hey, the Pfizer vaccine is getting ready to be authorized for 12 and up. I thought it might be helpful to have this information. And then what followed was information that had just come out from the Advisory Council on Immunization Practices about being able to co-administer vaccines with COVID-19 vaccines, because we hadn't been able to do that. Sent it out, and there was some blowback from that. Some providers, I guess, or recipients of that memo felt that it was undermining parental control of their children, and posted it to social media, and then started calling some of the legislators. And what this was a memo like every other memo I sent these providers throughout the course of the response, about different elements of how they were to store or obtain or administer these vaccines. So I'm not sure how sharing 34-year-old case law is a fireable offense, but the spin now coming from some of the legislators in government ops committee is that I was fired for the 38% uptake in Tennessee now. So it's
I saw
interesting
that.
how this will evolve.
Are you talking about Reagan's email back when he
Yes.
put that at the end of an email? So for people, I don't have that. I wish I almost brought that in here because I was going to mention it, but somebody emailed Rep. Reagan, who is the chair of the GovOps committee, about Dr. Fiscus's firing. And at the end of his very snarky email back to this person, this Tennessean, he also makes a comment about how we only have 38% of Tennessee vaccinated, as though Dr. Fiscus is somehow being fired for that when they have made it so hard to actually get people vaccinated. That was fascinating.
Yeah, and not unexpected at all. So, I've worked with the folks at TDH for a long time. I've worked with the communications folks at TDH for a long time, and I know how the spin works. So it's not unexpected. Actually, I'm surprised it took them so long. I got through a 24-hour news cycle without them coming back to disparage me. So it's okay. I know the work that I did. I know the partners that I had in universities across the state, in other departments within state government, in school districts across the state, where I helped to guide them through the last year plus. So I know what my accomplishments are, and I'm not concerned about what Representative Reagan might be accusing me of. So, but at any rate, the memo went out. People got upset.
How did you hear about the backlash? What was when did it first hit your ears that, oh, this is going to be a problem?
I think I saw it on social media first. I think someone posted on the TDH Facebook page about how, we were targeting children or trying to vaccinate children, without parents knowing about it. And then, my husband serves on the Williamson County School Board. So there was pretty immediate accusations of he and I being in cahoots with Williamson County schools to go in under the dark of night and vaccinate unwilling children without their parents knowing, which is against the law to administer any health care in a school without parental consent. So, but you know how things devolve and devolve quickly.
Well, there is a lot of crossover. I mean, you
Yeah.
mentioned your husband, Brad, we should say, is a Williamson County School Board member. He actually ran as an independent for the seat that disgraced ex-speaker Glenn Cassida is currently sitting in. And there is a lot of crossover, not only just in the way that this is going down, but I think actually in the people that are behind it. We've now seen that a group called Tennessee Stands, which you may have heard about if you're here in Tennessee at all, is essentially taking credit. They're celebrating Dr. Fiscus's firing. This is Elizabeth Murphy, who runs the Knoxville chapter of Tennessee Stands and is running for Knoxville City Council. Everybody in Knoxville should know, saying that basically a physician gave them the memo that Dr. Fiscus had sent out about the mature minor doctrine, and it was Tennessee Stands that started drumming up the anger and animosity and getting the Republican legislators riled up for that GovOps meeting. Of course, in the same post, Elizabeth Murphy is fundraising off of this and tap dancing. So yes, there's a lot of crossover, and people should be aware that the attack on our schools, the attack on our health department, the attack on people who are trying to do the right thing like Dr. Fiscus are coming from a lot of the same people. Sorry, go ahead.
Right. Yeah. So, what all of this culminated in was Tennessee Department of Health being called before the Government Ops Committee on June the 16th. I was in Anchorage, Alaska, celebrating my 31st wedding anniversary to the amazing Brad. And there were legislators in that committee hearing, and if you haven't listened to the video of that, I suggest you do, who actually called for the dissolution of the State Department of Health because of this memo that they felt was inappropriately targeting children. They also admonished the Department of Health for communications that were put out on social media encouraging children to get vaccinated. What they actually said was that vaccines are available for children 12 and older. But all of those communications originate through the governor's office. All of the communications are approved by the governor's office. And so I actually had nothing to do with any of those social media posts except to review the content that was presented to me. And they were all done through the administration. So it's interesting how things get twisted. I believe Representative Reagan has also accused me of using taxpayer funding to advertise to adolescents, which I don't have access to state funds. All of the activities that we do through the immunization program, Department of Health, are CDC funded. So that's federal dollars, yes, but actually sent to us for the express use of combating vaccine hesitancy and doing public messaging. It's actually in our federal grant that we are to do public messaging around COVID-19 vaccine.
It's generous of you to assume that facts actually matter to people like Rep. Reagan. But it's these things like they tell the story and they don't let facts get in the way, and people like you are who get hurt. And so you mentioned this GovOps meeting that happened, and I wanted to play a little bit of it. This is some video from the GovOps meeting where the Republican legislators they threatened to dissolve the Department of Health because of what we're talking about.
So we can come up with 8 kids statewide that have presented at health departments unaccompanied. 3 were my own children because they're 16 and their mom works.
We should let 14-year-olds, if they choose, have this vaccination. Is that correct?
That's correct. Yes, sir. That provision has been in place since 1987.
I don't know how the terms that I could use to express my extreme disappointment.
It's very disconcerting.
The Department of Health is targeting our youth. Personally, I think it's reprehensible that we would do that to our youth in Tennessee. There are people that have received the shot and gotten COVID. Remember Ronald Reagan saying the most fearful words in the world are, "I'm here from the government and I'm here to help." Everybody in the world is trying to get to Tennessee right now. I make a motion that we bring the doctor back here next month for consideration for the dissolving and reconstitution of the Department of Health.
It is not constitutionally mandated. I think it would be very unusual for a state not to have a Department of Health.
I'll be opposed to the motion. I just don't think that's a good way to run our government.
I'm not under the impression from any of this conversation that mature minor doctrine has posed a problem.
I think there is a sense that we're hiding in dark alleys and whispering to kids, "Hey, come get vaccinated." We're not doing that.
Under no circumstance is the department encouraging children to seek out vaccination without parental consent. The vast majority of kids that come in alone, 8, the parents know.
Okay, so people get the sense of what was going on that day. Commissioner Piercy was under attack. Very clearly they were implying that kids were being targeted, that there was nefarious things going on. It was really being led by Sapicki. He spoke for a very long time about this stuff. What were you thinking as you watched that go down?
Well, I didn't watch it until I got back from my vacation, and it sure took that kind of blissful feeling that you have for a few minutes when you get back from a break, and trashed that pretty quickly. I had heard from people that this saber rattling had happened around dissolving the Department of Health, which is a completely ludicrous statement.
During a pandemic.
Yeah, during a pandemic. Yeah, even in blue skies, dissolving the Department of Health that helps people with HIV and tuberculosis and identifies and treats STDs and helps with family planning and provides immunizations to the more than 50% of children in Tennessee who are covered under TennCare. So it's ludicrous that statement was even uttered. But I think what disturbed me the most after that was the response of TDH leadership to that saber rattling, which was to immediately place a moratorium on any COVID-19 vaccine outreach that we were doing to adolescents in the state. So that meant canceling COVID-19 adolescent pods that were being scheduled to bring kids in. And then very quickly devolved now into no immunization messaging whatsoever, whether that is around back to school vaccinations or flu vaccinations coming in the fall, or infant vaccinations or HPV vaccinations to prevent HPV related cancers in a state that has one of the highest HPV related cancer rates in the entire nation. And so now what we have is the wiping of boots on public health and the stopping of exactly what public health is to do, which, you know, the mission at TDH is to protect, promote, and improve the health and well-being of the people of Tennessee. And when we are now obstructing the access of to vaccinations, primarily impacting our poorer or Black or brown communities that, you know, have working parents that can't stop their days and take their children to get vaccinated, but sure can have them vaccinated at a school-based event, where, by the way, it's against the law to provide any kind of medical care without parental consent. So if what they're concerned about is minors going rogue and getting vaccinations at the behest of the Department of Health, the safest place to make sure that that's not going to happen is to have them vaccinated at school, where they have to have parental consent. So now what we've done is roll back all of these opportunities for vaccination, stop all of the messaging around any kind of vaccinations. We are behind by 30,000 kids that did not get MMR vaccines last year that should have, because of the pandemic, because they were afraid to go seek healthcare, because their healthcare provider wasn't available, because they didn't have PPE, or because the Department of Health was out in the parking lot swabbing people for COVID or vaccinating them and didn't have the bandwidth to provide immunization services at the time. We have 30,000 kids that we need to get caught up, plus the kindergartners that are getting ready to start school in 3 weeks. And now we can't have school-based back to school vaccination clinics, and we can't do any kind of messaging to parents letting them know that their child might be behind.
Right. So their reaction was not only to just completely cave and essentially concede the points that were being made about vaccine outreach to young people. They overcompensated and basically saw, okay, our base is, against vaccines in general, and now we're going to stop all vaccine outreach, period. So it sounds like what we have really is not only a movement against the COVID-19 vaccine, this is the anti-vaccine movement taking over the highest reaches of Tennessee's government. Is that what you see happening?
It absolutely is. And you can hear it in the comments that are made, during the GovOps meetings, that come straight from the anti-vaxxer playbook. At one point, Senator Roberts made the comment that the COVID-19 vaccine has killed more people than any combination of vaccines in the history of vaccines. That is because of a misinterpretation of VAERS data, the Vaccine Adverse Event Reporting System data. That is the surveillance system that's used to catch signals that where there may be a problem with the vaccine. For example, the J&J pause that happened because of thrombocytopenic thrombosis that was happening in 14 people out of more than 1 million that were vaccinated with that product. That VAERS system is what catches that signal and then prompts further investigation. But anything that happens related to getting a vaccine is reported to VAERS. So if I get a vaccine and tomorrow I die from a heart attack and I had a bypass surgery a month ago for my horrible coronary artery disease, it gets reported to VAERS as having had happened after a vaccine. If I get a vaccine and I cut my foot off with my lawnmower, it gets reported to VAERS as having had happened after a vaccine. If I'm a 97-year-old in a nursing home who gets a COVID vaccine and I die, it gets reported to VAERS as having happened after a vaccine. So what they've done is taken this information and said, oh, there's been 5,000 deaths reported after COVID-19 vaccine. There is no level of causation here. It is just that, yes, someone died, and yes, they had a vaccine. It could have been this person died, but we have to report that they ate broccoli 24 hours ago. It is this complete misrepresentation of that data. And so when Kerry Roberts says this has killed more people than any vaccine, he has taken that information straight from the anti-vaxxer playbook, taking absolutely no effort to go out and understand what VAERS data means, or talk to vaccine experts like myself, or reach out to Vanderbilt, where they study vaccines all day in the backyard, not in the backyard of Vanderbilt, but in his backyard, where he could take his pick of experts who could explain that information. Senator Bowling with, we don't need to vaccinate people because there's hydrochloroquine, ivermectin, and vitamin D. Hydrochloroquine that's been shown to not only not treat or prevent COVID-19, but actually cause harm. Ivermectin, which is a worming medicine that has not been shown to improve outcomes from COVID-19, and vitamin D, which has everyone has hung their hat on vitamin D, from treating liver spots to bone cancer, I think. So these are unfortunately citizen legislators who do not have a background in science, and seem to be frankly unwilling to speak to people who do.
I think that's all really well said. And Reagan actually in that email also cited that VAERS data that you're talking about. Worth pointing out, my friend Holly McCall posted this earlier, that just last year, Governor Lee had proclaimed August immunization month, vaccine month, basically, and now has issued a directive internally not to even mention it. She said life comes at you fast, which she's correct about that. So we've seen this complete flip. Meanwhile, now we have Tennessee ranking #1 in largest increase in new COVID cases. That's today. So that's what's happening. That's the backdrop for what's happening here. And it's become a national story. Tennessee was trending 5th nationally. We had people speaking out all over, Rick Wilson, Chelsea Clinton. This is basically what we're projecting to the world, is that we are an anti-vaccine state. And, we are firing the people who know what they're talking about, like Dr. Fiscus, rather than empowering them to do their job. You've mentioned on a couple of shows now, and I'd be remiss not to ask you this, you mentioned a toxic culture working underneath Governor Lee. You said morale was low. Can you elaborate on that a little bit? And I guess also maybe a message, if you have one, for the people that are still at the Department of Health.
Yeah, first, I think to the people at Department of Health, one, thank you for the tremendous outpouring of support over the last 48 hours or so. They are 201, the most wonderful people that I have ever worked with. I've had the honor to work with them for 4.5 years, and they are superb. They care about nothing more than promoting the health of Tennesseans up to a certain level. And but over the last year, more so over the last probably 3 or 4 months, the toxicity within the Department of Health, because of the leadership there, has been palpable. People are walking on eggshells waiting to be fired. The governor's office trolls our social media accounts to make sure that we're not posting anything that might look not only disparaging of the government, which we wouldn't do, but even getting ahead on any kind of messaging. I remember I posted a message on my Facebook account, which, I was pretty active in social media from an education standpoint. I have a large number of followers. I use that as a platform to put out vital, correct, fact-based, evidence-based information for people to consume and share. And very early in the pandemic, I posted about antibody testing, and how antibody testing was not really helpful in determining if you're immune to COVID-19, or if we know that if you're positive, you've been exposed, but we don't know if you have immunity that is protective or not. And I was admonished internally for doing that, because it was messaging kind of ahead of where the department was at the time. And so that there has been just toxicity around that. Colleagues that have posted postings about Black Lives Matter or other social justice issues that have been admonished by our administration.
And does this come from Governor Lee himself? I mean, I just want to be clear about that.
Yeah, I'm not clear about that. You know,
Okay.
it trickles down to us from, you know, our boss's boss to our boss to
Sure.
us that, you know, hey, there's talk that you posted something to social media and that's not acceptable. You need to, you know, go take care of that. So, so yes, there's been this growing level of toxicity, and then more and more we have been unable to follow CDC guidance and unable to message CDC guidance, and that is where you know, we in public health really have difficulty, is in this position between being scientists and physicians and epidemiologists and experts in public health, listening to the federal and sometimes international public health recommendations, but then working with Tennessee elected officials, appointed officials, and our citizen legislature, who does not have that level of understanding of how to mitigate the worst pandemic in over 100 years, and being unable to message or try to enforce or even highly recommend that certain mitigation things be put into place. You know, we begged for a mask mandate, we couldn't get it.
Right. So that's what I was going to ask you. You know, this sort of segues nicely into the question that I really wanted to ask you, which was, you know, obviously there's probably a long answer to be had, but is there an abbreviated answer to be given to the question of how do you feel Tennessee did during the pandemic?
Not well. You know, we had high death counts. We had tremendous case counts. One of the reasons that we had such a blessedly low positivity rate here recently is yes, because we got our most highly vulnerable people vaccinated to a very high percentage, 75, 80%, but also because we have such large temporary herd immunity because of all the infections that we've had. 170,000 children that we know of that were diagnosed with SARS-CoV-2 infection over the last year. These are not small numbers of people that have been infected, and so, you know, we're going to be able to ride that for a little bit until that immunity wanes, or until the Delta really comes in and takes hold, and we find out that natural immunity doesn't protect people. But you know, we didn't have a mask mandate. We were one of very few states that didn't. Governor Lee was actually heard to say that one of the good things about not having a mask mandate is you never have to worry about when to stop it. We never
He said a
had
lot of things. I mean, his saying, you know, the storm is passing every single day while people were dying was, you know, I can't imagine how that felt internally. When you saw pictures of him, you know, when we had the mask issue and he was not wearing them when he was in rural counties, did that affect things internally?
Oh, definitely. I mean, we would hang our heads and shake them, and you know, we can't believe this is happening when you know, the pandemic was basically declared over, and you know, he was on Twitter in restaurants right next to somebody without a mask on, when you know, there's just so many things that we could have done to even just strongly encourage people to do the things that we need to do to mitigate this disease. And you know, now I'm terrified. 3 weeks away from school, we have them under vaccinated, not COVID vaccinated, not even COVID vaccine eligible in a lot of cases, no mask mandates in schools for the most part. I haven't heard of any that are being put in place. No ability to socially distance in school because there's no remote learning. And so, you know, these kids, I fear, are just going to be sitting ducks waiting for this more infectious variant to come through that is impacting kids. There's 7 kids on ventilators right now in Mississippi because of the Delta variant.
I read that. It's horrible. And, you know, the other thing, by the way, we could talk about the, you know, efficacy of the vaccine and whether or not kids should be vaccinated and whether or not 14-year-olds are old enough to make this decision. But at the end of the day, you asked for guidance. You were given guidance. You were told it was blessed by Governor Lee and it was okay to share it. You shared it. You got fired. This is not about having these debates about the vaccine. This is about being scapegoated by a governor who is being pressured by anti-vaccine, anti-science legislators. So, we've had people come at us on social media saying, parents should be able to make these decisions, freedom this, freedom that. It's not about that. This is about a public servant who did her job and got fired for it. So, we can have that debate all you want. You can jump on here and talk to us about that. That's not what this is about. This is about, a political firing and somebody whose life has been upended. And, we really appreciate that you've come on here. I don't want to keep you too much longer. I know you are doing other stuff. I think you're on Maddo tonight. I did want to flash this picture of Chris Hayes hearing your story last night. I mean, that Chris Hayes, that was a face that he wore throughout most of your interview. And that, really, I felt that face in my guts. I do want to ask you one more question. You can answer this or not, but John Ray Clemens yesterday, when we talked to him, he felt like Dr. Piercy should have stood up for you, should have, basically fallen on her sword and said, you're not firing Dr. Fiscus. If you fire her, I go too. How do you feel about, I don't want to mention the, political aspirations. Some have speculated on that. I'm not going to ask you to speculate. Do you wish she had stood up for you?
I am disappointed that, that the truth didn't come out about the memo that, our general counsel was also present in that hearing. And he knew that he sent me the email that said that the language was blessed by the governor's office and that I could share it as I felt appropriate. And so I was very disappointed that he didn't stand up and say something that Dr. Piercy not only didn't defend that publicly, but also didn't even respond to things like Senator Bowling's comments about ivermectin and hydroxychloroquine when she had the opportunity to do it. And yes, Commissioner Piercy has said very openly in the Tennessean that she aspires to be governor or senator or to have a White House appointment, a cabinet appointment. And so it's hard to imagine that some of these decisions to placate the legislators wouldn't have something to do with her political aspirations as well.
Well, I think that's well said. I would definitely tend to agree with you. Again, I so appreciate you coming on here and talking to us about all of this. I so appreciate that you're doing the right thing and speaking out about all of this because, it will help people. It will save lives for you simply to just talk about this stuff. I don't know that much is going to change politically around here, but I know that you speaking your truth is going to help people in some way, shape, or form. And, I don't know where you're headed next. Do you even know where you're headed next? What's next for you?
Yeah, we don't, we have talked, my children are older. They're both in college, getting ready to leave. We're going to be empty nesters for the first time. And we have been very open with our discussions that we will likely leave the state. I don't think there's a reason for us to stay here. And I'm really torn about that because, if all the good people leave, then what are we left with? And at the same time, Brad and I have both dealt with our share of this toxic partisanism. And, there's just kind of only so much one person can take. So
I know this is the issue that I have with, we try to report on all this stuff and we try to let people know what's going on in our state, but I am constantly dealing with that issue, which is the more you talk about how messed up this place is, the more we lose good people. And, you're not the only one I've heard say that they might leave. And I understand it. I don't fault anybody for making the best decision for their family, but it is Tennessee's loss, as people are saying. And, I really hope that the people who can, and I'm not passing judgment on you've gone through something here. I have no idea what your professional options will be next. So you guys need to do what you got to do. As long as you stay in touch with us, Brad, I'm talking to you. But the people who can stay, I really hope you'll stay and fight to save Tennessee from this nonsense because it's worth it. But I understand what you're saying. So, what you need to do what you need to do.
Yeah, I'm hoping that some of this, there are 64 people in my position in the country. That's the 50 states, DC, some of the large cities like San Antonio and Philadelphia and New York and Chicago, and the territories, Puerto Rico, Virgin Islands, and the tribal nations. So 64 of us in the whole country that rolled out this vaccine to our jurisdictions. I am the 25th of those 64 to leave their position this year. And I think that says a lot about how well we can continue to weather this. Some of these people, Bob Swanson in Michigan was in his post for more than 30 years. Stacey Hall in Louisiana was forced out of her position, as I was. The person in the position, even in Vermont, which has one of the highest vaccination rates in the country, left her position because it became too much. So this has been a Herculean effort that has fallen on the shoulders of 64 people, primarily, with tremendous partnerships with every aspect of public health and private and public sector folks. But it's a lot, and many of us are working in these very, very toxic environments, and there's just so much you can do. The one thing I wanted to mention too, though, is regardless of how you feel about whether or not a 14, 15, 16, or 17-year-old is mature enough to be able to make a decision to become vaccinated, it is case law in the state of Tennessee for 34 years. And so they do have that right in the state of Tennessee. My memo was not a commentary on that. It was telling providers of those vaccines what the rights are of those individuals, that they have the right to choose to get vaccinated without the consent of their parents if they want to. And terminating me on Monday didn't change that. It is still the law in Tennessee, case law in Tennessee, that if they want to go and get a vaccine, they can do it. So it's really hard to find justification for relieving me of my duties when my team and I and all of the folks through the Department of Health have done a really extraordinary job of getting this vaccine out to an unwilling public, unfortunately.
Dr. Fiscus, thank you so much for joining us. Thanks for all you've done. And we'll be watching as this unfolds. And I hope you and Brad and your family all the best. And please let us know if we can be helpful at all. Thank you so much for doing this.
I appreciate your time, Justin. Thanks so much.
Take care. So that is Dr. Michelle Fiscus, who was just fired by a cowardly governor who caved to the whims of an anti-science faction of the Republican Party here in Tennessee, which, frankly, it's not a faction. It's just the party. It's not really just a small part of the party. It's the party. This is how they think. This is what they believe. But as Dr. Fiscus just said, it's not about whether or not you think that's the right thing. It's the law. And the party of law and order should support the law. This is case law. And all she did was share case law with doctors who are administering this vaccine, physicians, the distribution network who are asking questions. She got it blessed by the Department of Health, by Governor Lee's administration. They told her, go ahead and share it. Then she shared it without a commentary, as she just told us, and they fired her for it. There's no defending that. That's not defensible. Don't come here talking about, parents' final decision, all that. That's not what this is about. We can have that discussion. This is about being somebody who, if you just watch this interview with an open heart, you can tell that her heart's in the right place. And if you can't see that, then that's a you problem, frankly. So this is about a woman and her family who are now going to have to uproot and leave Tennessee, maybe, because this governor doesn't have a backbone, to put it mildly. And how has that impacted your community? How many people died that didn't have to throughout this pandemic. You know, you just heard one of the top officials at the Tennessee Department of Health say that we didn't do that well throughout the pandemic. And you've got all of these people throughout the state crediting Governor Lee with the response, but you've got his own officials telling us we didn't do that well and pointing out that his hypocrisy when it came to masks and things like that hurt them, hurt their morale, affected them, impacted them, and probably led to more loss of life than needed to be. So I appreciate you guys watching this. I think we all owe Dr. Fiscus and her family a debt of gratitude, especially for what they're going through now. And to the Governor Lee administration officials and maybe some others who are watching this, shame on you. Shame on you. Not only for what you did to Dr. Fiscus, but for what you're doing to our state, for what you're doing to health in Tennessee, for what you're doing to education in Tennessee. It's all the same. It's all linked. F in education funding, bottom in poverty, number one in medical bankruptcies, number one in rural hospital closures, the bottom in infant and maternal mortality. This is all on you. This is because of your ideology, and it's all linked. And there's no escaping that. So you owe Dr. Fiscus an apology. You owe this whole state an apology. And we will continue to holler the truth about what you're doing. Thanks, everybody, for joining us.